What specifically is patient and provider shared decision making? The definition of shared decision making is an approach where healthcare providers, the doctor, nurse practitioner, physician assistants, for an example, and the patient and family share the best available evidence or research or data when faced with the task of making important decisions, and where patients are supported when considering their options to achieve well-informed patient-specific preferences. So the focus is primarily on the patient and not necessarily the provider. At its core, shared decision-making rests on accepting individual self-determination as the desired goal, and providers need to support the patients and their families in achieving this whenever possible. Achieving shared decision-making requires building a good relationship between the provider and the patient, where patient preferences and personal views are supported when making clinical decisions about best care options. The requirements of shared decision-making include patient choice, understanding what the options are, and being able to talk about the decisions. Simply stated, sharing decisions versus providers making decisions on behalf of the patient and family. Shared decision-making requires good communication skills by the provider. This is essential to allow the patient and family to understand what their options are, and based on options, determining what is best for their care. It is essential between the provider and the patient of sharing high-quality information, that is, credible research data used to inform standard of care and what is in the best interest of the patient. To determine the best options of care, what are the pros and cons, and understanding that the more informed the patient and the family are, the better the outcomes. To learn more about shared decision-making, go to Multiple Chronic Conditions Resource Center